Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau. Finally, someone willing and able to blow the top off hidden healthcare and hospital dangers. She's provocative, upbeat, balanced, fearless, fresh. Pat has over 20 years of experience as a professional public speaker and knows how to approach this important subject with enough humor and wit to keep you informed, entertained, and empowered. Each week you will say, "Oh," as Pat explores and exposes little-known hospital hazards, delves into the deep waters of dangerous healthcare practices, picks the brains of her good-looking and influential guests to help keep you and your family safe in today's fragmented healthcare system. The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, always happy to share this time with you. I look forward to it all week and am happy that you do too. Today we have lots of names in store for you, from a robot named Louise to a guest named Rachel, who is going to share vital information about hospital never events and so much more, to a game show contestant named Casey, and a reminder from me about a young lady named Samantha, also known as Miss Maine, the daughter of a previous guest named Tom, and I hope you cheer for her tomorrow evening, June 8th, as she vies for the title of Miss USA, all the way to my favorite guy named Bob, who I'm sure will share his fun thoughts during today's gamelet of Jeopardy. So, enough of my name dropping, let's get started. And now it's time for the hospital hazard of the week.
Hello, I am Robot Rouleau. Oh, sorry, we are not hiring. I never get sick. I do not require maternity leave. I never get sick. I am never rude or rushed. I am the perfect solution for all of your people problems.
Robots or real people?
It looks like you are going to be leaving the hospital soon. The computer will see you now. I am programmed for your protection. Do you have any questions about this condition? Questions, 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 questions.
Well, you've heard me talk about how hospitals now receive financial incentives and disincentives based on the results gleaned from actual patient satisfaction surveys as well as on hospital readmissions within 30 days. So now that patient satisfaction and the patient experience are tied to hospital reimbursement, hospital leaders are looking for solutions to improve these scores without adding more work to already overworked staff. That makes sense, right? Well, enter Louise, kind of like the virtual assistant, only she is an avatar head. Like a cartoon talking head on a computer screen, a robot, if you will, that is designed to improve the discharge process. Now, you've also heard me talk quite a bit about how dangerous discharge is when you leave the hospital to head home or to another facility. Many times, the process is sketchy at best, and patients leave without knowing their diagnosis, what medications to take, who they should see as a follow-up and when, what side effects to look out for, or even if they have a pending test result. Everyone, including the patient, is in such a hurry to exit the scene that it's quite common to land back in the hospital as a readmission. Bad for the patient and bad for the hospital, as they get docked financially when that happens. So what's the solution? A robot.
I am programmed for your protection. Do you have any questions about this condition?
Well, there's a fairly new program sponsored by the government to the tune of $7.5 million that has had a successful pilot program at Boston Medical Center. It's called Project RED, an acronym for Re-Engineered Hospital Discharge, and the software produces an individualized after-hospital care plan for each patient. This summary includes information about medications with pictures of the pills, with thorough instructions on when and how to take them. A color-coded calendar tracks follow-up appointments. All of what should happen during a proper hospital discharge is built into this virtual encounter. In this way, much of the education component that is missing during discharge can take place and be tracked. The patient can review the information over and over again without feeling like anyone is getting impatient with them. Louise asks questions. The patient can answer via the computer touchscreen, and Louise even attempts to change her tone of voice to simulate empathy. And the eyebrows, whoa, they move up and down too, almost to the point of creepy. Well, this Louise is now being used in 49 states and 10 countries. In a pilot study of this automated virtual nurse system, 74% of hospital patients said they preferred receiving their discharge instructions from the virtual nurse, Louise, rather than their human doctors or nurses. What an interesting dichotomy. I can fully understand the advantages to both the patient and the hospital to invite Louise to the party. But if this is a substitute rather than an add-on, or becomes a substitute for follow-up from a real live human being who actually has had experience with that individual patient and his or her unique diagnosis, prognosis, and so on, then I guess it makes me kind of sad. Sad that we are heading in the direction of removing people from the equation. Not only in healthcare, but everywhere. Automated checkouts, tellers. Soon we won't need people. Or is that the point? I'm skeptical, folks. There's always a bigger picture. It's like a bad dog who knows not to enter a certain room and little by little inches his nose, then his paw, then his head into the forbidden room until one day, there he is, sitting on the dining room table. Do we really want a talking animated head with really scary eyebrows and eyes that pretend to open wide with interest and empathy to guide us through perhaps the most crucial time of a hospital stay? Are we really okay without the human voice, the human touch, the glance that says, "I hear you"? Or have we slowly been prepared and desensitized for this as we lovingly caress and gaze at our smartphones, never really communicating with another or understanding their concerns, just mindlessly looking down, engaging our thumbs instead of our hearts? LOL. 74% of the people polled thought this fake head was preferable to an honest conversation with another warm-blooded human soul? I don't know what to think. What do you say? Robots or real people? Call me and share your ideas. 440-725-5462.
We have covered everything in the booklet. All right then, I think that about covers it. Goodbye. We have covered everything in the booklet. All right then, I think that about covers it. Goodbye. Bye. 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 Goodbye. Bye. 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 Goodbye. Bye. Bye. Bye.
You've heard me talk about senior helpers on this program. Well, today let's take a peek at some of their services. For their basic level of care, caregivers provide services such as companionship, meal planning and preparation, light housekeeping, laundry, medication reminders, and other general assistance. For sitter services, caregivers sit with and monitor a client during their hospital or facility stay. The caregiver can then follow the client home to provide a smooth transition. And we all know how important that is. Now, for personal care, their professional and experienced caregivers provide basic companion care plus assistance with the activities of daily living, such as bathing, dressing, grooming, toileting, and ambulation assistance. Their caregivers are also available to provide 24-hour coverage. Live-in care can be provided for a minimum of 2 consecutive days, up to 7 days per week, indefinitely. And then there's my favorite, the Peace of Mind Visit. Their unique Peace of Mind Visit program is a short visit each day to help clients with, among other things, bathing assistance, meal preparation, medication reminders, getting out or into bed, and check-ins. Then there's transition assistance. We know it can be challenging for families when a member is discharged from a hospital. This service ensures that clients are guided through the outpatient surgery and recovery period. They're available for help prior to surgery and will accompany a client each step of the way through full recovery, including transportation to follow-up doctor visits. That is huge. And then there's respite care. That's a unique program to assist families by providing care for a short period of time, such as vacations. So you could see that no matter what your needs, Senior Helpers are the answer. Call them today and begin the conversation. They're local and they're friendly. Senior Helpers, 1-877-922-STAY, S-T-A-Y. That's 1-877-922-STAY. Senior Helpers, care and comfort at a moment's notice.
Senior Helpers.
You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau, always bringing you the best of the best when it comes to our guests. And today's guest fits that bill. She is Rachel Weissburg. Let me tell you a bit about her. Rachel has spent the last 10 years working to improve the safety and quality of healthcare in the United States with a focus on person-centered care. She currently works at the National Quality Forum in Washington, D.C., and manages a number of initiatives under the umbrella of the Partnership for Patients. Rachel also spent over 4 years with the Leapfrog Group, and we've had them on the show before, a healthcare membership organization representing purchasers of healthcare. And during that time, she worked closely with the Centers for Medicare and Medicaid Services to shift reimbursement models from a fee-for-service to a fee-for-outcome model in over 37 regional markets. And while at Leapfrog, Rachel was responsible for writing the first national policy that asked hospitals to openly acknowledge seriously reportable events, or never events, and take remedial action if these events occurred in their facilities. So much to talk about, so welcome to the show, Rachel.
Thank you. It's good to be here.
Thank you. Well, you've had an exciting and an impressive journey, and usually we ask our guests to start from where they are and share their personal story. But lately we've been changing it up a little bit. And so today, if you don't mind, let's work backwards in your career. I mentioned in your intro that you worked at Leapfrog Group on never events, and we've talked about them quite a bit on the show. So I'm interested to talk for a bit about these serious reportable events. And I guess they used to be called never events, but they're situations that should never happen in a hospital. And I know our listeners would be interested in that as well. So those are things like wrong site surgery, unintended retention of a foreign object, pressure sores, things that shouldn't happen to a patient in the hospital. So now the Centers for Medicare and Medicaid and even some private insurers said, hey, if these things happen, we're not paying for them.
That's right. And it's a little bit shocking that that would even be a question. You have the wrong limb amputated and you would still get a bill for that. But there were cases where that was actually happening. So, the public sector is somewhat limited in terms of things that they could do. So they really focused on the payment aspect. Leapfrog took it a step further, and they had a 4-point policy. I believe it's now a 5-point policy. But at the time, they asked hospitals to apologize to patients if something like this happened, to report it. We gave them 3 options of places that they could report it publicly, to do a root cause analysis, and of course, not to bill the patient or a third-party payer, so that the bill wouldn't end up with even a health plan. And actually, I need to credit Health Partners in Minnesota. They were really the forerunners of this. We worked very closely with them and really patterned the policy after a lot of the things they had done. So, yes, there are a lot of different sort of buckets of the never events. There's the sort of criminal events, like if a patient, God forbid, got raped or killed in a hospital. There's the get surgery done on the wrong part of your body. Something happens like an infant goes home with the wrong family. Something happens where you have a medication error. There are different sort of buckets of things that it groups into, but they are all pretty pretty awful.
Right. And we talk about many of them on the show. Now, patients and the general public doesn't know about these never events. So let's say somebody gets stage 4 pressure sore in a hospital and they still get billed for it. If the patient doesn't know, I mean, is there a possibility that this does get passed on and the patient still ends out paying their 20% copay on it? How is the patient enlightened as far as this goes?
That's a great question. There's still a huge gap in understanding on the patient level. I know that Leapfrog really does attempt to use their website to educate patients and consumers about the policy, about options. If a hospital says, we agree to this policy, they are publicly stating that on the website, and therefore their community should be held accountable. But in terms of, your average Joe, do they understand? Do they know the term never event? Do they know what to do if they end up with a bill for something like this? Unfortunately, a lot of it goes to litigation, and unfortunately that simply perpetuates the cycle, because if a hospital doesn't simply know the right thing to do, which is to go to the patient and admit fault, and or even just say the words, "I'm sorry," and let's work with you to make this right. What happens is it simply it creates a sort of a vicious, the patient sees the provider as the the bad guy, and vice versa, and it really makes the whole process very, very difficult. So there needs to be a lot more education done to try and break down that cycle.
This kind of ties in because we're talking about medical errors and maybe the reimbursement models have something to do with that. So I mentioned that you worked with the Centers for Medicare and Medicaid Services to shift the payment reimbursement model from a fee for service, so you get paid regardless of the outcome. Explain to us what that means.
So in the United States, we have the very strange system where you go to the hospital or you go to the doctor's office, and we just, this is the way it is, so we don't even think about it. But physician or, the provider of care gets paid regardless of the quality of care that they give. So if I get better and the doctor does a wonderful job, they get paid as they should. If I get sicker and the doctor wrongly diagnosed me and therefore I need to go back and get a second diagnosis and a different kind of medication, then the doctor is actually strangely rewarded by getting paid twice or 3 times. So there's no incentive or very little incentive to actually give the correct care other than simply doing the right thing. And I don't want to imply that doctors and clinicians in general are trying not to do the right thing.
Right.
Because I don't believe that at all.
I don't either.
I know and work with so many amazing, amazing clinicians who are just really give their all to their profession. And I am a patient, and I have an amazing team of clinicians without whom I would actually probably not be alive. I mean that literally.
Right.
I owe my life to them, but unfortunately, we are all human, and we do need a system that supports quality care, and we don't currently have one. So what is trying to change in the United States, and the Affordable Care Act did put in quite a few measures to try and change this, is to provide incentives, many of them financial, that give doctors an actual financial incentive to provide quality care rather than simply just care, period, rather than just a fee-for-service model to change to a fee-for-outcome model, and an outcome being obviously, hopefully, the positive outcome as quickly as possible.
Right. So I don't know if our listeners know this or remember this, but currently part of the hospital's or the physician's reimbursement is based on patient satisfaction surveys. And we all get them after we've had a hospital stay. And I know sometimes people just toss them out thinking, well, it doesn't really matter. But nowadays our voices are heard, and some of the reimbursement from Medicare is based on those surveys. So can you tell us a little bit more about that?
That's right. There's a lot more emphasis now on patient satisfaction and what do patients think. I work at an organization, the National Quality Forum is primarily an organization that focuses on healthcare quality measurement. And there's a lot of work being done around what are called patient-reported outcome measures. So this is a good and positive thing because for a long time, the patient voice and the patient perspective has been extremely minimal. This is a culture change, and providers are not used to this, and therefore there's been some resistance. Speaking as a patient, I've probably filled out, over 100 patient satisfaction surveys in my adult life. Sometimes you wonder, where do they go? Are they scientifically valid and all of those things? But I think that the direction is the right one to go. And I think that having patient-reported outcomes and definitely with the HCAP surveys, getting the patient experience into models of care is incredibly important, and I'm excited to see that we're going in that direction.
Yeah, I agree. Hospitals are becoming more interested in the patient experience now because they're getting incentives and disincentives. And it is the right thing to do. I just spent time at the Barrel Institute conference and recently spoke at the Cleveland Clinic Patient Experience Summit, and just people from all over the world coming together to have this conversation about the patient experience. Whatever the catalyst it was or is, it's a good thing.
Definitely.
Absolutely. So you mentioned briefly that you work at the National Quality Forum in Washington.
I run a patient family engagement action team, and that's actually my favorite project that I work on because patient family engagement is near and dear to my heart.
Probably because you have your own health journey that colors your perception of patient safety and the patient experience. So maybe you can share a bit of your personal story and how that ties in with what you're doing and what you're seeing.
And yes, you are right. That is definitely very personal. Ironically, I got into healthcare sort of accidentally. When I graduated from college, I started having some severe migraines, but they didn't really become debilitating until I was in my late 20s. And I went through a period of time where it was about 2 years where I was so sick that I could barely function. I was in and out of hospitals almost every week. I worked with a whole team of specialists, and they couldn't figure out exactly what was wrong with me. They tried 36 different medications on me in the course of 9 months. I was in absolute excruciating pain on a very, very regular basis. I really had reached a point of sort of resignation that would be my life when one of my specialists had a rare, humble moment and admitted that he didn't know what to do with me and asked me if I would be willing to go to, I was living at the time here in Washington, D.C., and he asked me if I'd be willing to go to Chicago to a special clinic there for headache patients. And I did. And that was the best thing for me because I went there, I was diagnosed, and they figured out the root cause of what was happening, and they took me basically off of, I did an entire month of detox and really got me stable, which I've been for a while. But in the years since, I've also been diagnosed with 2 other chronic conditions. And so now I juggle three chronic conditions, and although in general I'm able to handle that, I do take 8 daily medications, and I still go to the ER about once every 4 months. I was actually just there on Sunday.
Oh my.
That is just sort of the course of my life. I spent so much time at my local hospital. So my passion for person and family-centered care is driven a lot. I see a lot of that work through a very personal lens of what I need when I walk in as a patient, because I'm completely vulnerable in that moment.
So we always ask every guest, what does the patient experience mean to you personally?
I think that for me, when I walk into a hospital, I am usually in such excruciating pain that I I actually have had thoughts of, I want to die. I'm in that much pain. It's not that I'm in a suicidal place, but I'm in a extremely, extremely vulnerable place. And what I need to feel safe in that moment is not just drugs, which is what is given to me through an IV, but I need human touch and I need words of comfort. And sometimes I am given that, and sometimes I am not. And what I want for every patient is to experience that level of patient safety when they are in any healthcare setting and they are equally vulnerable.
Oh, wow. That's huge. I mean, it transcends the clinical side of it or the expertise side of it or the pharmaceutical side of it. It is the person. I mean, it's the relationship and just the human connection.
Yes, yes.
Oh.
I had a nurse this last Sunday when I was in the hospital who I want to nominate her for Nurse of the Year.
Oh.
She was like an angel. She anticipated everything I needed, and I felt so safe in every possible way, and it made all the difference. And my gratitude is beyond words when I received that.
Mm-hmm. So with that in mind, is there any way that patients and families can really help improve their experience? I mean, if you're experiencing a provider who's rushed and hurried and kind of short with you, can we really come out and say, hey, this is what I need. I need you to slow down. I need you to talk to me and give me a hug. I mean, can we go that far?
That's a great question. And I think the answer is absolutely yes. Some of my dearest friends I have two really good friends from college, actually, who are practicing physicians in hospitals, and they are some of the most compassionate people I know, but also the most direct. And I think that knowing how they would respond if they heard that from a patient, I think the answer is absolutely yes. Mm-hmm. That, first of all, the patient is a human. We're all human beings. We have the right to state our needs in any time and place. And to engage from human to human, regardless of the patient-provider dynamic, just to reestablish that equality is so important. Mm-hmm. And I think that there are a lot of things we can do. We can come prepared, if at all possible. For me, I come prepared with letters that state exactly what medications I'm on, exactly what to give me when I'm in the hospital, that has been written up by my specialist, and it really does help. Sometimes I ask for it, and sometimes I'm in so much pain I don't, and it's hard in those moments. It's tough.
Yeah, I can hear it in your voice.
The only other thing I would say is that, families and patients, they often see the provider of care as sort of the end-all be-all, as the person with all of the knowledge. Mm-hmm. And while there is so much that healthcare providers do know, they are also looking to the patient to be respectful.
Right.
And to listen to them and to receive what they're saying. But I think that the patient needs to often be a little bit bolder to be willing to engage, as you said, and to ask for what they need and to state what they need. And I have found that in my experience, it's never appropriate to be rude. It's never appropriate to be any more pushy than you would want to be in any other situation. But it's okay to simply engage in a dialogue, and most providers are very open to that.
Right. Well, I agree. That's what this show is all about, is to empower people, give them that information, and give them the confidence to do exactly what you're saying, to speak up, but always in a polite and respectful way, of course.
Right.
So, well, now, where can our listeners go if they want to find out more about you or the National Quality Forum?
I have a LinkedIn group, and you have to join it, but it's open to anyone to join. I would just encourage anyone who is interested in keeping up the conversation around patient and family engagement. Google National Quality Forum Patient and Family Engagement. Our group should come up, and anyone can join.
Such a pleasure. I'm so glad we got to know each other.
Thank you so much.
Are you looking for a relaxing and rejuvenating spa experience? Aren't we all? Well, I found the perfect place. Listen as I spend the next 2 minutes with Lisa Stewart, owner of Solia Spa in Brecksville, Ohio. She has the experience and knows how to exceed your expectations. All right, well, Lisa, tell us about the services you offer at Solia Spa and how they just might be different from every other spa.
So we offer skincare, different facials, different kind of skincare treatments for the face, and then also massages, body wraps, and of course nails as well. We look at the skin and we address extrinsic aging, which is outside aging, and intrinsic aging, how the body ages from the inside. And our core is education. So it's really important for us to educate a client, talk to him or her about their skin, their concerns, what we think, or we just want them to do what's right for their skin.
So Lisa, give us all of your contact information. Where can we find you and Solia Spa?
Solia Spa is in Brecksville, Ohio, which is south of Cleveland, and our phone number is 440-526-0522. You can find us on the web, www.soliaspa.com. Solia is Solia.
I appreciate your being here.
Thank you. It's a blessing. Thank you so much.
Relax and rejuvenate your body and spirit at the luxurious Solia Spa. Choose from a variety of massages, body scrubs and wraps, skincare, makeup, and nail care. Their professional staff is trained to help you select appropriate services and provide impeccable personalized service for an experience that exceeds your expectations. Welcome to Solia Spa, located at 6909 Royalton Road, Brecksville, Ohio, or call them 440-526-0522. And be sure to visit their website, soliaspa.com. You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rulo. So happy to spend this hour with you to help you survive any healthcare or hospital encounter. And remember, if you like what you hear on this radio show, I speak live and in person too. In fact, we're even better in person, right, Bob?
You better believe it.
Our presentations are fast-paced, interactive, and chock full of immediately usable patient safety tips and tools. I can guarantee that your crowd will love it. So email or call me to talk about speaking to your business, your club, church, or hospital. I speak both to the patient side or the provider. Email us at speakupandstayalive.com or call me directly at 440-725-5462. You and your audience will be glad you did. Well, today we opened the game chamber and everyone decided to play one of our most fave games. Are you in Jeopardy or are you safe? Here's how it goes. I will describe a healthcare or hospital associated scene and you, our contestants, have to decide how you would react to the situation. Are you in Jeopardy or are you safe?
Is Don in the booth? He's ready. Okay, here we go. In 5, 4, 3, 2, cue lights, music.
Now entering the studio are today's contestants.
Oh, I'm Bob from Gatlinburg, Tennessee, and I'm a former financial planner.
And we have another guest contestant. Who do we have with us?
You've got Casey Quinlan, the Mighty Mouse of Mighty Casey Media and author of Cancer for Christmas.
Author of Cancer for Christmas. So we've got two great contestants with us today. And we have our dedicated to patient safety listeners from all over the globe.
These people will compete today on
Are You in Jeopardy? Or are you safe? All right, you guys ready?
Let's go for it. What do you think, Casey?
Yep, let's go.
All right, here we go. Here's the first scenario. You were recently discharged from the hospital. A few days later, you receive a phone call from the hospital social worker to arrange an in-home visit to assess your surroundings and your progress. Are you in jeopardy or are you safe? What do you think, Bob?
I think you're in jeopardy.
What do you think, Casey?
Lacking any other information, I would say that I was in jeopardy because I don't think that I need a home visit. Why am I getting a home visit? They haven't made that clear to me yet.
That's good. That's what I was thinking too, Casey.
Oh my gosh, you guys are working on threadbare information, but here's what we're thinking. Okay. There's a recent 2-year study that collected data from approximately 100 patients living independently, but at a high risk for hospital readmission. The experimental group experienced only a 7% readmission rate versus a national high of 30%. Because the social worker did come by and see them. They're thinking that a social worker can prevent readmissions, and the patient's quality of life is improved significantly in the process.
I didn't realize that it could actually save the hospital readmission by somebody checking.
That's true, that home visits can make a huge difference. So I needed more information. So based on the lack of information, I said, I'm not safe.
Well, then I agree with you both. We're going to have to hit the person that wrote these questions.
Okay. I like that, Casey.
All right.
Don't hit him too hard.
Oh, my God. They're cringing in the other room. All right. Here's scenario number 2. Let's hope there's enough information. You are a low-risk patient in the hospital, there for a few days. Every night you are awakened every 4 hours to check your vital signs. And I guess the key here is you're a low-risk patient. Are you in jeopardy or are you safe?
So, Casey here, I would say that you're safe. However, the person that keeps wandering into the room is not, because they're running a risk of getting backed upside the head with something hard, because it really is not smart to wake up a low-risk patient every 4 hours. They could sleep, and healing happens during sleep. So I'd say overall, they're not unsafe, but it's not a great plan.
I couldn't have said it any better, Casey. That was very good.
You guys are awesome. That's right. Hospitals have been checking on vital signs every 4 hours since 1893, like Florence Nightingale. Yet about 45% of hospital patients belong to that very low risk category. Given what we know about sleep disruptions and how detrimental they are to actual clinical outcomes, we would hypothesize that decreased sleep interruptions in this low-risk patient population would improve outcomes. And this would also free up nursing time for other more critically ill patients. So I think you guys hit that on the head.
Yep.
Good going. All right, here's scenario number 3. You are a patient in the hospital. Your nurse attends to you with a sniffle and a raspy throat. She says it could be allergies. Are you in jeopardy or are you safe?
In jeopardy. She
definitely
should not
in
have
jeopardy.
Come to work. Yeah, and I mean, if it's the kind of thing where she has to be there, for whatever reason, she should be wearing a mask. She should be wearing fresh gloves, fresh mask, fresh gloves every time she goes into a new patient's room. But bottom line, she really should have stayed home.
Absolutely, you're both right. 2 recent studies provide more proof that healthcare workers should avoid patient care when feeling sick. From November 2009 through April 2010, researchers collected biweekly nasal swab specimens from 159 physicians, nurses, and staff, and found those folks were working while ill happened to be a routine. And healthcare workers with respiratory symptoms were associated with viral shedding, which can spread the infection.
Wow.
Yeah.
Yep.
That's called health worker presenteeism, and it can risk patient safety and employee safety. So what would you guys do if your healthcare workers said that they thought it was an allergy?
I would ask them to please have somebody else come in.
Yeah, well, I'd ask them to, at minimum, mask and gloves. And if not, just to say, I really am not comfortable. I need someone else in here.
All right. Good. Speak up, right?
Speak up. Do not be a meat puppet.
A meat puppet, as Casey always says. All right. Here's scenario number 4. You go to a doctor whose website touts plastic surgery. You need just a little lift. The website says board certified. Are you in jeopardy or are you safe?
I would say there is no way to tell, because they can be board certified in gastroenterology or board certified in ear, nose, and otolaryngology, something that has nothing to do with surgery or that level of safety. So board certified is meaningless unless it is board certified by the American College of Plastic Surgeons. And even then, I would want to see additional learning. I would want to see, board certified is meaningless.
I agree with you. It needs to say board certified for plastic surgery in that realm.
Absolutely.
Period.
Absolutely. You're both so right on with that. Some docs out there bill themselves as board certified without specifying the specialty. Remember, we had a certified plastic surgeon from Beverly Hills on the show last year who told us about a gynecologist and primary care physicians who added cosmetic procedures to their services and allow the patients to believe that they're board certified in dermatology or plastics. The patient needs to know what they're certified in. And I was really shocked to find that there's no laws in the United States that require doctors to practice only within their specialty fields.
The board certification thing is a misnomer, and it really is truly meaningless. So I think that the healthcare industry really needs to do a better job policing itself. Yeah.
Well, this is good information. Once again, for our listeners, you got to do your homework.
Indeed.
Yay. All right, here's our final scenario. Your child cut himself with scissors. The doctor looks at the cut and announces that all is fine, but then the doctor stops and asks if there is anything else that you wanted to say about the scissors. Is that a good practice? Are you in jeopardy or are you safe?
I think you're in jeopardy.
Casey here. A better question for the doctor to ask is, what else have these scissors been used for? In other words, if they're kitchen shears, and you've been using them to cut chicken and they haven't been through the dishwasher yet, there's stuff that could be on there that could be a risk to your child and might need additional disinfection, some additional, say, antibiotic ointments to prevent possibility of infection. The doctor needs to be a little clearer about exactly what he or she is asking.
Right. I think the point of that was that at least he asked, because this happened to be a true story that somebody was talking about this new, very new tool called narrative medicine as a way for a physician basically to ask questions. But it turns out in this story that the parent was very concerned because they had a boarder that was renting a room in their home who was HIV positive. And
we see, there you go.
Yeah, and previously cut himself with the scissors, and she was worried that the son could have been exposed to the virus. Now, if this doctor had not asked any more questions and would have just said, hey, it looks fine to me, the mom would have gone home and nobody would have known. So, I think I find it interesting that they call it a new tool, like narrative medicine.
But in my house, it's always been called conversation.
Hello? Well, guys, I'm not sure who won that game, but I think you're all winners because now you know a little bit more about patient safety. So thank you, Bob, for being on the show today.
You're quite welcome.
And Casey, thank you for joining us.
Thank you again for having me. I love it here.
Thank you, friends, for playing our newest and our most fun game ever. Are you in jeopardy or are you safe? Don't go anywhere. There's so much more you can learn about healthcare and hospital safety on America's favorite and perhaps only patient safety radio show. Speak Up and Stay Alive, RadiOh.
RadiOh.
Let's spend the next 2 minutes with Hari Khalsa, a healthcare advocate who is highlighted in my book, Speak Up and Stay Alive. Hari helps people just like you throughout the country whenever you have a healthcare-related question. Welcome to the show, Hari.
Thank you, Pat. It's always so wonderful to be here with you and your listening folks.
Yay, we love having you as well. Well, now, many times a doctor or a group of doctors come up with a treatment plan that is difficult for the average person to understand or even comply with. How can you help?
Being a nurse practitioner, I really understand the medical side. I understand the medications, diagnosis, and I understand the goals that the doctors are talking about. Sometimes I can pick up the pieces that are missing in the treatment plan. I can talk to the doctors. I can say, look, you haven't talked to this doctor, and the treatment plan isn't whole. We need to coordinate all the pieces so that the person knows that they're getting everything they need with their treatment plan. And I can also take a look at the medications, because you'd be surprised that either the medication list isn't in one doctor's notes, it's not complete, another doctor may have really old medications. And so what I can do is look at the treatment plan and say, no, this person is actually allergic to this medicine, or this medication was stopped a long time ago. It's important to have somebody help you look at the treatment plan and know that it's the right treatment plan for you. So that's what I like to do, and that's why it's really good to have someone like me, because I do understand the medical side, and I can help you understand it as well as communicate with the doctor when you're having problems.
Yes, and you're really good at what you do, so I really encourage folks from around the country. They can contact you. You don't have to be in their neighborhood. You can still work with them via phone.
So wherever you are, I'm here.
Hari, it's always a pleasure to talk with you.
Thank you so much, Pat.
All right, folks, now you don't have to be alone during a healthcare crisis. Hari is available to you and is just one phone call away. Call her to discuss and solve your healthcare needs. It's 1-866-980-4325. 1-866-980-4325. What happens if you become unable to speak for yourself and are in the middle of a healthcare crisis? Wouldn't it be comforting to know that someone you know and trust, a family member or trusted friend that you named, is on your side with complete instructions that mirror what you want to have happen to you? If you do not have a properly drafted living will or healthcare power of attorney, you are living dangerously. And if you do have these documents, when was the last time you reviewed them with someone? Well, my friends Pat Schraff and David King at Schraff & King are the ones to help you. Call them right after the show at 440-585-1600, 440-585-1600, or visit them online at schraffking.com. Do you or someone you know work in the healthcare field? Ask them if they know that bacteria can live on fabric for weeks and even months. Think of the cross-contamination opportunities. Think of scrubs. How are they washed? With bleach? Oh no, that would ruin the pretty colorful designs. Most scrubs are made from poor quality broadcloth and are not bleachable. BrendaJune.com scrubs, their fabrics drape beautifully, they breathe, and they move with you as you go about your busy day. Pants, skirts, tops, their fabrics are durable and bleachable. If you wear scrubs, you owe it to yourself and your patients to wear scrubs responsibly. Visit BrendaJune.com for high-quality, American-made, bleachable scrubs. That's BrendaJune.com. Take control of your protection today. Visit BrendaJune.com or call 1-855-668-7278. They make a great gift too. That's BrendaJune.com. You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am Pat Rouleau, your hostess and author of the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, available at all of our live speaking events or at our website, speakupandstayalive.com. That's where you can also locate radio showtimes, dates, and station information. That's speakupandstayalive.com. And if you want to purchase the book but do not have internet access, it's okay to call me. Lots of folks order the book by phone, so give me a call, 440-725-5462. Well, now let's take a peek at the Speak Up and Stay Alive calendar. You've heard our friends, Hospice of the Western Reserve, on this program before. In fact, they are one of our sponsors. Well, they are having their third annual Walk to Remember. Funds raised will directly support Hospice of the Western Reserve patients and families. And you can make a difference. Gather your friends and families and join them on Sunday, June 8th at the Cleveland Metro Parks Zoo. This will be a fun-filled day for all ages and a wonderful way to celebrate life with your family and friends. Admission includes all-day entry to the zoo and rainforest, children's activities, snacks, t-shirts, entertainment, and more. So for more information, call 216-383-3715. That's 216-383-3715. 216-383-3715. And then another sponsor, Senior Helpers, is holding a special evening called The New Age of Long-Term Care. Does your family have a plan? That's going to be held on Thursday, June the 19th at the Strongsville Recreation Center. The address is 18100 Royalton Road in Strongsville, and that will be held from 6 to 8 p.m. in the evening. That's Thursday, June 19th, Strongsville Recreation Center from 6 to 8. This is going to be an evening focused on the discussion of long-term care needs that we all face. The panel members specialize in life care planning and legal strategies for long-term care insurance, financial planning, home care assistance, and hospice services. They will come together to discuss how you can plan for the future. And I will be there as the moderator for this panel discussion, so I'd love for you to be there as well, and we can meet. It's free and open to the public, but they would appreciate reservations, so give them a call at 330-723-4444. That's 330-723-4444. And of course, refreshments will be served, so I hope you can make it. That's where you can also purchase signed copies of my book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, along with other life-saving goodies that we have to offer. Plus, most importantly, I'd love to meet you. The people and the businesses that you hear each week on this program are here for a reason. They are some of the best in our local area who strive to serve our community, and I encourage you to do business with them. Now, if you missed some of today's show or you want to share it with friends, we've made it easy for you to hear it again. You can go to the radio link at the speakupandstayalive.com website, click the link with today's date. Again, that's where you can also purchase the book, Speak Up and Stay Alive. I can't tell you how many people have told me that they take the book with them to the hospital or they bring it as a gift to a friend in the hospital. Simply lay it on the tray table and how that generates such positive conversations with the healthcare staff. Now, at a glance, they know that you are an e-patient. E stands for empowered and educated. So if you do not have a copy, I really do encourage you to have one. If you don't have internet access, it's okay to call me and order by phone. Many folks get the book this way. Plus, I always enjoy talking to you, our listeners. Call me directly, 440-725-5462. And be sure to listen next week, as we always have fresh, informative, and fun facts and some foolishness to share with you. Same time, same place, but never the same information. And in the meantime, I hope you have a healthy and a happy week. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem and should not be considered as medical advice. If you've missed part of today's show or just want to share the information with friends, you can listen to all of Pat's previous shows at speakupandstayalive.com. Want even more information? Purchase a copy of Pat's book at speakupandstayalive.com. Once again, it's speakupandstayalive.com. Or you can call Pat at 440-725-5462. Until next week, remember, it's okay to ask others to wash their hands. You have to speak up and stay alive.